Phenylketonuria, or PKU, is a genetic disorder in which the body lacks phenylalanine hydrolysis, a necessary enzyme needed to metabolize phenylalanine levels. If a PKU patient is left untreated, the disorder can cause brain damage, progressive mental retardation, and even death. About 120,000 babies in the United States are born with a birth defect each year. Or to break it down for you, that's a 1 in 33 chance a child has at having a birth defect. 550 of these birth defects in the state of California are registered as PKU.
I'm Richard Koch, and that's spelled K-O-C-H since it can be pronounced in many ways. And I'm a physician, and I've been in practice here in Los Angeles Children's Hospital for 50 years. And I retired recently since I'm getting a little hard of hearing and other vagaries for my age. And I found that retirement was too easy for me, and so I have kept up private practice on my patients who have phenylketonuria. You may wonder why I've selected phenylketonuria. It's because in medical school in 1947, I saw a patient in the neurology clinic at the medical school where I went, University of Rochester in New York. And the mother was Ian, a very lovely person, and she had 2 mentally retarded children. Anybody could see that they were obviously retarded. They didn't speak, and they weren't toilet trained, and they didn't feed themselves. And yet here this woman was taking care of those 2 children at home. And she explained that this was a hereditary disease, and that after the second child was born, they decided not to have any other children, and the father had a vasectomy. That left quite an impression on me because I had never dealt with any mentally retarded persons before, and I did not run into a patient with phenylketonuria in the rest of my medical school training. But when I was a resident at the Children's Hospital in Los Angeles, a woman came in with 2 mentally retarded children, and I was in the situation at the Children's Hospital, asked me to take care of these 2 patients because I had already had the experience of taking care of one of them. And so I sat down with this family, and they had a 3-year-old who was walking. Wasn't toilet trained, but he was a nice little lad, and a older sister who was 9 years old, who was blonde and blue-eyed, and that's the typical appearance of a person with phenylketonuria. That's a metabolic disease that causes mental retardation, and they have high blood phenylalanine levels. Phenylalanine is an essential amino acid in your diet and mine.
With such high levels of amino acid in their bodies, PKU patients can disintegrate exons and neurons in their brains.
Well, when you have phenylketonuria, which I will shorten to PKU because that's the name that everybody recognizes. This was my second case, and here I was just a resident in pediatrics, so I thought maybe this was fairly common. And subsequently, when I graduated from my residency training, I became the director of a mental retardation program at the Children's Hospital. And I was selected for that because of my prior experience with 2 patients, which wasn't very much. But I had some questions about whether I really wanted to take the job of running a mental retardation clinic. Well, that turned out to be pretty rigorous. The first patient I had was a patient whose parents had a Down syndrome child. You know, that terminology in the olden days was called Mongolism. And I no more than sat down and began to ask them questions, and then I used the word mongoloid, and Mongolism being the term that I had learned in medical school. And the father got up and looked at me right in the eye, and he says, there are no Mongoloid people in my family. And he picked up the child and the mother, they left. Well, that was my introduction to mental retardation. Anyway, I survived, and then lo and behold, a patient came in with phenylketonuria who was obviously mentally retarded. And this was a situation where we knew it was hereditary. We knew there was no treatment. And I found it difficult to tell this young couple that probably they shouldn't have any more children, because we weren't able to diagnose PKU prenatally. In other words, if they conceived a baby, we wouldn't be able to do any test that would show they had another child with that disease. Well, the father asked the logical question, well, what are my chances? I mean, are they 100% that I'll have another PKU child, or what? So the answer there, of course, is well known. Their chance of having another PKU child is 25%. 2 children out of 4, for example, would be statistically liable to have a carrier status, and then 1 person out of the 4 would be entirely normal. So the first question the mother then asks, of course, is that, well, what about the carriers? Are they perfectly normal people? And I said, well, I think you and your husband are perfectly normal people, and both of you are carriers. And